Hello everyone, welcome back. I'm sorry that I did not post a video in the past 2 days. These past days have been hectic, very hectic, and we've been seeing a bunch of different patients. And between being in the hospital at 7 in the morning and leaving it around 4, 5, 6 in the afternoon to keep reading and studying, it's been quite a difficult time to actually record and upload some videos. But first off, I want to start saying that this has been an amazing experience, to say the least. It's far exceeded my expectations in not only what I was going to see, what I was going to experience, but also in what I was going to learn and the opportunities and doors taking this step into kind of the unknown and kind of the disaster side of medicine would bring. So I have a lot of things to say. Today is April 6th of 2020. I know of a couple days after my last video, but I'll give you an update on everything that has gone on. So first off, I don't mean to start kind of in a somber and a sad tone, but I don't know if you remember the last patient or the last patients that I discussed in my last video, the 28-year-old patient. The day after I saw her and we admitted her, we didn't have her in the hospital anymore. We were actually wondering what happened. We are not entirely sure as to what happened with the patient, but it seems like this 28-year-old girl who her only issue was uterine bleeding that was controlled with birth control did not do well overnight. Her pressure seemed to have bottomed out, decreased to the point that she had to be transferred to the main hospital and seek the higher level of care that could not be given at the hospital. So I truly hope that she is in good condition, in better condition than what she was when she arrived. So I don't really have much update in terms of that. My other patients, remember the end-stage renal disease patient, 80-some-year-old that also presented with COVID. He did have the past couple days a worsening cough, but his respiratory drive and his respiratory effort has not really changed. The cough was was able to get better control with some of the medications, and he is doing better, as well as my other two patients. And fortunately, today precisely, one of the patients that I've been taking care of, I was able to discharge him today, and impressively, this is a patient, a pretty big patient, obese patient, and a quadriplegic patient actually, that suffered from hypertension, and it filled me up with joy and hope that this is something that's gonna pass. This is something that we will overcome together, because that person, having all the comorbidities and all the other conditions that he had, including being quadriplegic, being able to see how he actually recovered and he was able to be discharged today to a facility was incredible. I don't really have much other words than being joyful at the fact that he will not be one of the numbers counted as deceased. We can count him as recovered, and that is an amazing feeling in this situation. So that is kind of in short of how my patients have been doing. Also, because of the amount of patients and because of all my patients ended up being COVID, through this week and through this past couple of days, I was kind of officially assigned to the COVID unit. So every day I had to go see, because all my patients were in the COVID unit, and so I had to dress up every day. I had to wear a full-on Tyvek suit, head protector, hairnet, bouffant hat, goggles, N95 mask, surgical mask on top, double set of gloves, and a face shield. I had to do this every day, every morning, to go see every single patient. Same with the nurses. And it really put in perspective what we're dealing with. We are, unless you're right there working with those patients, I understand that it can be a little difficult to grasp as to what actually happens and what actually entails treating a patient with COVID. And because of not only the knowledge that we had that it spreads through contact, as well as respiratory droplets by sneezing or by coughing, or sometimes even by just breathing and talking, but also the risk of transmitting through air as well. I know it's kind of a difficult concept to grasp, I understand, in the general population, well, because it's an invisible enemy. You can't see it. And to have to put on all this protective suit day in, day out, to be able to see the patients really brought into perspective what we were doing and what we were dealing with. A highly infectious disease has been an amazing experience that I will certainly bring back, not only, well, in terms of how to protect yourself, how to manage, but also how to treat. And then the other thing is that despite the first day being incredibly busy, the amount of patients that we started seeing in the ED were less and less. And so we are, according to the graphs, and this brings, well, a lot of joy and optimisms. We always prepare for the worst, but we always try to see things as optimistic as possible. And it says that at least here in Louisiana, we've peaked. And that brings kind of a sense of triumph and a sense of joy, in a sense, because although we're not laying our arms down, we will continue to be prepared. It's certainly something that it seems to be reflecting as well in the emergency departments. And so because of that, I truly want to thank every single person in Louisiana of being part of the solution and staying home, giving all they got, even though that the quarantine may have you crazy. I want to let you know from a doctor standpoint, from someone who's been in the front lines along with the rest of the team that I'm here with, that it truly makes a difference. And even though it's kind of obscure to you to know, allow me to say it again. It really makes a difference, and it helps us help you. So thank you. And the other thing that happened throughout this week was that our LSU chancellor in Shreveport asked us to stay another week because of the work that we've been doing to not only will help the hospital that we're in now, but also they mentioned he asked for us to stay another couple days to help out the main hospital here in New Orleans. So we'll be moving approximately from tomorrow afternoon onward until about Sunday to work at the main hospital here in New Orleans. And as I mentioned before, I've learned a significant amount of stuff, not only in terms of how to manage the patient, but also in terms of the treatment and what has been coming out in the recent days. So for example, the hydroxychloroquine, azithromycin, zinc, and vitamin C, it's a pretty standard regimen that it's being given to the patients. And although we don't really understand on its entirety what it's doing, because, well, we're still in the works of deciphering all the answers, it seems to be helping somewhat in some sense. What is it? We don't totally understand, but it seems to be that patients are doing relatively well when we treat them with those medications. The other thing we noticed is that here at this hospital, they are trying to avoid as much as possible going from they're having difficulty breathing and on room air to directly to intubation. And this was a very distinctive thing that I was able to notice, and in terms of our attending as well as our group, because all the standards and all the guidelines are to avoid this aerosolization or this transmission through air because of the type that of oxygen supplementation, how it's delivered. The guidelines said to, well, go straight to intubation, in short. But the thing is, and this is the interesting part, that ventilating a patient and putting a patient on a ventilator, automatically, in most cases, the best chances for the patient to get off a ventilator is about 40%. And so putting that into perspective and putting so many patients in ventilators kind of gave also a perspective of the possibility that, well, maybe we would need to look at this in a different angle. It's not that we're doing anything bad right now, because we always do the best we can with the information that we have available and in the best way possible, but sometimes maybe it's just a little looking at things through a different lens. And by avoiding having automatically intubate the patient and having them sent directly to the ICU, maybe trying to these other methods of giving them oxygen, even though it may potentially transmit a little bit more in the air in the room, it may end up being, and reiterate, it may, because we don't have all the answers, be something that helps the patient in doing better. So it's something that we'll definitely continue looking at and evaluating and see what actually is the reason. So recently, about a couple of days ago, not only the federal government but the CDC changed their stance in terms of the general public using masks. And I'd like to talk a little bit more about what does this mean and kind of clarify what we're talking about. And the recommendations of the CDC and the federal government, yes, everyone in the general public should wear masks, but the type of masks that they're discussing and they're talking about is cloth masks. These, the ones that can be done at home, but not the surgical mask, not the N95 respirators. These are still recommended to be only for healthcare providers. So the premise is kind of something is better than nothing at this point because of how fast and how rapid this virus spreads, but also because we're assuming, or we're parting from the mentality that everyone's infected. And so if we assume that everyone's infected and everyone should protect themselves, and so try to, whatever, sneeze, cough, or talking, whatever can be held back, even though if it's not completely, whatever can be held back is better than not having anything and just putting everything out there with either a sneeze or a cough. So we're just trying, with this measure, it's not game changer necessarily, but it certainly helps in the long run, even a little bit. So if we keep our mask, I encourage everyone to, use their cloth mask. Again, please don't use surgical masks or N95. Use the cloth mask as they recommend. Also, in terms of the respirators, I want to make very clear in terms of the respirators, the N95, and I've seen in multiple different places how to do kind of homemade your own respirator using a specific type of fabric and whatnot. I want to be very clear. I want to give a general kind of advice to be careful with these. Not that not everyone should be wearing a respirator. This is because some people with COPD or some other lung disease are at risk of getting harmed by using these masks. So these masks are to be worn by healthcare professionals, and these need to be tested, and a thorough history of the person should be taken before they start wearing this mask. So please be very, very careful with doing respirator-like masks at home. Stick with the cloth masks, please. Also, as part of this ordeal and disaster medicine fiasco that's been amazing and so exciting, we were actually contacted, and our attending was interviewed multiple times by interested in our story by the Channel 12 in Shreveport, Louisiana, the Channel 3 as well news, and finally, actually, as recent as today, our attending was called by CBS in New York to kind of get a grasp and interview for what's going on and the story that's been going on. So it's incredibly humbling that something just so tiny that we just went a couple of volunteers because we felt the call to do so, to honor our oath, to share what we know and help out who needs the most, not only patients but also colleagues. Turned out to be such a big thing, and it makes me very proud to be part of this team. Not only me, but also I'm very proud of our attending, Dr. Cornelius, and the rest of our residents that hopefully I'll be presenting them on a later video if they'd like to. And finally, I would definitely like to extend not only a thank you to the general public for being part of this solution and for helping us help them, but also from a doctor standpoint, I want to thank the nurses who are the most exposed daily and are right and left hands every single day with every single patient. They have been putting out 110%, every single nurse I know. So from the bottom of my heart, really thank you, and I appreciate every single thing you've done, the best of your efforts, and it's amazing. Also, I want to thank the EMS, the firefighters, the police, who, despite everything and not necessarily having all the medical knowledge, they still go out and do their best and help us with the general public in all their different aspects. So again, all of them, I'm greatly appreciative of what you have done. And finally, I wanted to also bring up, because not always they are the most noticed, but throughout this week and this whole COVID situation and going down the halls of the unit of the COVID, I constantly saw the janitors and the environmental services people, and it made me actually think, no, they're not involved directly in the medical care of the patient, but day in, day out, with all this PPE being used and thrown out and reused, and having all this mayhem going on, and having always the hospitals as clean as they can be, there's someone who is doing this. And so, although sometimes they're in the shadows, they are helped too. And I want to thank every single one of the janitors and every single one of the people who do in the environmental services in every single hospital, not only the one I'm working, but every single hospital. Because even though behind the scenes and they're not necessarily taking care of the patient or making decisions for the healthcare of the patient, they are the ones who expose themselves as well, cleaning everything up after us. So again, thank you immensely, and thank you to everyone else who has supported every single healthcare provider from day one. So I will see you in the next video. I'm sorry this is kind of a long one, but there was a lot to discuss and a lot to share. So I will do a next video soon, and I will see you then. Until, I wish you a happy and healthy life.